Good evening. This is Tuesday, the 8th of February, 2022. I'm in the house this evening. It's a little cold outside and the heat is not on in the camper. We went over this morning for a 10 a.m. appointment with our surgeon, eye surgeon there for a pre-surgery appointment, an examination. Going to have the lens replaced in my left eye, which reminds me I intend to get a big fat magic marker. And come the morning of the procedure, I'm going to draw a big arrow on my forehead, right down here to the left eye. And maybe even on my forehead point, this eye, please. Or not. My wife reminds me that they usually put some sort of a tag or something on your left arm or your left wrist if they're going to do your left eye. But I digress. The reason we're having this done is because I have a cataract forming. Which brings me to the story I wanted to tell on the right eye. I've already had that one replaced back in 2009. But that was rather unexpected because in 2008, going to the local eye doc here, I was complaining that I was seeing spots and little flashes whenever I turned my head, and the doc said, "Welcome to old age." I said, "Well, I thought presbyopia was old age. That's where you start wearing reading glasses because you can't focus on anything on the printed page up close." And he said, "Well, that's number one. Number two is you get the floaters. Those are the spots in your eyes. And number three, for giggles and hee-hees, you get the flashes. That's the little flash of light when you turn your head too fast or you move your vision, your eyeball too fast to one side or the other." And I said, "Pray do tell." And he said, "Yes, the floaters that are simply a little leakage from the veins inside your eye and forming little blood clots, and they float around in the fluid inside your eye, and that's the origin of the old spots, I guess. And the flashes, they come from the edge of the retina and whatnot. So not to worry, not to be disturbed. It's normal with old age." But he said, "Your floaters are a little bit heavy, so we could fix that." He said, "I'll schedule you for a little laser treatment that will be performed over in Mount Vernon. It's a young specialist who comes up from Seattle. Lay you back in a chair, shine the laser beam in your eye, and zap those little leakers in your retina that are causing the problem, and you'll be as good as new." I said, "Okay, well, if you think." So we did. And I've got to tell you, that was one of the most agonizing experiences I've ever been through. I leaned back in the chair, the young fella got everything set up, he shined that laser beam into my eye, and I have never endured such an agonizing, painful, uncomfortable, torturous session in my whole life. It was memorable. So I went home and things were cool for a while. Floaters sort of dissolved and went away. But I started having problems with my vision after a few months, and then in 2009, my optometrist said, "You have got a severe cataract in your right eye." Oh, joy. So he scheduled me for lens replacement. That was my first cataract surgery. It was performed at a little hospital down in Oak Harbor at a little surgical clinic off to the side. A little Japanese lady trained in Tokyo did an absolutely marvelous job. But I've had nothing but problems with that right eye ever since. And it wasn't what she did. It wasn't that new lens. It was the retina. And it got to be so fuzzy and patchy, like looking through a window glass that you have smeared patches of Vaseline onto the glass, and you're looking through that, and you have to find a clear spot to look through. And that was an experience with my right eye. I had to move it around to focus on something to find a clear patch. Now you understand what the prime eye, your primary eye is. If you're right-handed, generally your right eye will be your primary eye. You pick up a camera and look through the viewfinder, you'll do it with your right eye. You pick up a rifle and look through the gun sights, it's against your right shoulder, you'll look down the sights with your right eye. You pick up anything like that and you'll sight down it, and it's your right eye doing most of the work. Mine wouldn't work for that anymore. The vision was so poor. So I had to switch to my left eye. So now I'm dragging my camera across my face, across my nose, to get the viewfinder lined up with my left eye, which is still good and clear and sharp. Okay. We adjusted. And so basically my right eye serves only for stereoscopic vision. It works with the left eye so that I can see things near and far. You get 3D vision. You can judge distance with depth perception. It takes two eyes to do that, and the right eye functions for that. Okay, so now I'm developing a cataract in the left eye. They're going to replace the lens, and all will be well. That'll be yet to be determined. They'll call me in a few days and say when I'm supposed to come over. In a conversation with the surgeon today, setting this up, a really pleasant, nice lady, I emphasized to her, I said, you know, if something goes wrong with this, I'm going to be legally blind. And she sympathized with me, and I told her this story that I just told you about enduring the laser treatment. And I said, you know, if I were to run into that young fellow again, I would ask him if he had hemorrhoids. And whether he does or not, I would say, you know, I've got just the treatment for you. It involves a laser, and we'll just burn those suckers right off. How's that suit you? Well, not really, but it's a nice thought. You all have a good day now, and thanks for listening. Bye-bye.